Hi, thanks for stopping by today. Today I have an exciting topic of discussing holograms in medical care. And we've all seen holograms on our driver's license or credit cards, and it's a 3D image that makes it look like it's there, but it's really not. And it's quite fascinating what they're doing with the application of it for our health care. And often they're used with virtual consultations. We see that in the United States as well as other countries such as India, China, Taiwan, and in Japan too, where there are some on remote islands that make it difficult for them to get to the doctor's office or some of these medical facilities. So what makes it far superior to Zoom is that it actually appears as if the patient is in the room in a three-dimensional form, and it's quite astounding. There's a really great video on YouTube, and I'm going to share the title of it with you so you can look it up via a search on YouTube. And I hope you'll check it out because it really is interesting to watch. And this is the title noted in red: Healthcare Holograms, UCF introduces Dr. Hologram, dated August 14th, 2021. And the application of this is also used for training of medical students at some institutions, and they may use this instead of cadavers. And also doctors at some facilities are using this to plan their surgery ahead of time. So for example, let's say a heart surgeon has an upcoming heart surgery to perform, and by using this hologram, they can actually see an image. It's almost like it's floating in air of that organ. So they can go in and turn it, manipulate it, and almost as if they're performing the surgery before the date of the surgery to some extent. And it's quite fascinating. And I have a great video. I hope so much you'll check this one out. It's just fascinating to look at. It's actually in 4D, what they call 4D. And the title of this one, you can do a search on YouTube as well, is noted in red. And that is St. Cloud Hospital first to use 4D technology during heart procedure, dated June 24th of this year. So I hope you'll look at that, and it shows it pretty much what I'm talking about. You'll see that doctor kind of looking at that image. He has special glasses in this video, and it's just very interesting. Another use for this I've heard is with colonoscopies for diagnostic purposes. They can use this to lessen the risk of some of the traditional colonoscopies. Now, I'm not a doctor or a medical professional, but my understanding is that the patient's on a table and still has a tube inserted, but it's a smaller tube and less risky, and I don't think the patient has to be sedated. And I understand that you still have to do the prep work for that though, so drink that gooky stuff. But I don't think it detects the smaller polyps as well, so it's something, if you're interested in that, to talk to your doctor about to see what might be the right approach for you. But I found it interesting that that is an alternative, and it has been actually for quite a few years. So this is used now, and it's certainly the way of the future. We see it for use in pathology, urology, and orthopedic and ophthalmology with the eyes, so it's definitely going to become even more prominent. So I hope these insights are helpful, and please join me next Friday because I'm going to be talking about blood pressure and how difficult it is sometimes to find someone who can do an accurate reading, and how some of the methods we're using to take blood pressure and some of the machines we're using may not really be that accurate. So I have a lot to cover, and I hope you join me then. And thanks for joining me today. Bye.